A lot of retirees believe Medicare will cover long-term care if they ever need it. That assumption has destroyed a lot of retirement plans because the type of care most people eventually need, help with bathing, dressing, eating, supervision, or simply living independently, is not covered by Medicare long term. And by the time many families realize this, they're already in the middle of a financial crisis. Hi, I'm Drew with Retire Safer, a licensed health and life agent. And this video is for educational purposes only, not for personal financial or insurance advice. In part one, we talked about why long-term care is such a major retirement risk and why roughly 70% of people turning 65 will need some form of care during their lifetime. But today we're going to talk about the part that shocks most families, the actual cost, what Medicare really covers, what it doesn't, and why so many retirees end up paying enormous expenses out of their pocket far sooner than they ever expected. Hi, I'm Drew with Retire Safer, a licensed health and life agent, and this video is for educational purposes only, not for financial or insurance advice. Let's start with the numbers. According to recent national long-term care studies, help at home from a non-medical caregiver, things like bathing, dressing, meal preparation, transportation, or housekeeping now averages around $80,000 a year annually, or $80,000 a year nationally. Assisted living is averaging around $74,000 a year, and in nursing home care is where the numbers become staggering. A semi-private room averages well over $100,000 per year nationally, while private rooms can run closer to $130,000 or more depending on the area. And those are national averages. In many higher cost states, the numbers are dramatically worse. The important thing to understand is this. Most people do not have a separate bucket of money sitting there ready to absorb an extra $80,000 to $100,000 per year for multiple years. That's why long-term care becomes one of the fastest ways retirement savings can disappear. And the costs themselves are only part of the problem. The bigger misunderstanding is how Medicare actually works. People assume Medicare will simply take over if they ever need extended care. But Medicare was never designed to cover long-term custodial care. It was designed primarily for acute medical treatment and short-term rehabilitation. And that distinction matters. Medicare Part A does provide limited coverage for skilled nursing facility care, but only under certain conditions. First, you generally need a qualifying 3-day inpatient hospital stay. Second, you must require daily skilled medical care or rehabilitation services, things like physical therapy, wound care, IV medications, or other medically necessary skilled treatment. And even if you qualify, the coverage is temporary. Generally, Medicare will cover the first 20 days inside a skilled nursing facility. From days 21 through 100, you begin paying substantial daily coinsurance amount. After 100 days, Medicare will pay nothing. But here's the part most families never see coming. A lot of people never even make it to day 100 because Medicare can stop covering skilled nursing care early if the patient no longer is showing measurable improvement. This happens all the time. Someone has a stroke, a fall, maybe even a hip replacement. They leave the hospital and enter rehab expecting Medicare to cover the stay for several months. At first, everything seems fine. Therapy is happening, Medicare is paying, the family believe the system is working the way they expected it to. Then progress slows down. And suddenly, there's a determination that the patient no longer qualifies for skilled care under the Medicare guidelines. The care shifts from rehabilitation to custodial care. In other words, help with everyday living rather than medically necessary recovery. At that point, families often receive a notice that Medicare coverage is ending, sometimes with very little warning. And then the financial reality hits immediately. Now the cost may become several $100s per day, entirely out of pocket. Not next year, not eventually, but immediately. This is one of the biggest shocks families experience during retirement. They thought Medicare was going to cover long-term care. What Medicare was really covering was a short rehabilitation window. And once that window closes, the responsibility usually shifts to personal savings, home equity, family caregiving, or eventually Medicaid after a significant asset spend down. That's why so many adult children end up stepping into caregiving roles unexpectedly. And it's why long term care impacts far more than just the finances. It affects marriages, children, retirement timing, stress levels, careers, entire families. This is why long term care planning matters. Not because every person will face the exact same situation, but because the financial damage can be enormous when there's no plan in place before the need shows up. And the hardest part is that most families don't discover the gaps until they're already in crisis mode, trying to make medical decisions, care decisions, and financial decisions all at the same time. Retirement isn't just about building assets, it's about protecting them from the risks that can destroy them later. Because in the end, most retirement planning still come back to those three major risks: outliving your money, dying too soon, or needing long-term care. And long-term care may be the least understood out of the three. If you want help thinking through your situation, please reach out. My contact information is in the description, and I'll walk through it with you and help you think through some options. And if you found this helpful, please like and subscribe for more Retire Saver content, and I'll see you in the next one.